Dr. David Oehme here. I'm a neurosurgeon and spine surgeon based in Melbourne, Australia, and today I'm going to be talking about laminectomy to treat spinal stenosis. Laminectomy is a really common operation that spinal surgeons do. It forms the beginning of most spinal operations. In order to best understand what a laminectomy is, it's important to understand what the lamina are. If we look at this model of the spine, we can think of the spine really consisting of three parts. We've got the front of the spine consisting of the vertebral bodies and discs. We've got the middle part, which consists of the nerves all running through the spine on their way to the legs or the arms. And then we've got the roof of the spine. Now it's the roof of the spine which we call the lamina. It's made up of bone and also some ligament underneath. Now, when the spinal canal, or the space where the nerves are, is narrowed, we term this spinal stenosis. In order to treat this, we de-roof the spinal canal or remove the lamina from the back. We can see here the various lamina stacked up on top of each other here. A laminectomy involves removing all of these bones to create more room for the nerves. A laminectomy is typically performed under general anaesthesia. Patients have no awareness of what is going on. You have a small incision in the midline of your back, and we carefully dissect the muscles off the bony parts of the spine. Once we have the bony part of the spine exposed, using drills and fine instruments, we carefully remove the bony lamina and also the thickened ligament off the nerves to decompress the spinal canal. Once the pressure is off the nerves, patients typically get good relief of symptoms. Laminectomy is a common and safe operation. Having said that, there are some risks that need to be factored into the surgery. Infection is 1%. Infection can occur with most spinal operations and is 1% or less in most surgeons' hands. Bleeding can also occur with the laminectomy, and whether or not you're likely to need a blood transfusion really depends on how many levels are treated. With most 1 and 2 level laminectomies, the requirement for a blood transfusion is very low. One of the biggest concerns a lot of patients have is damage to the nerves. Fortunately, this is a very rare complication of spinal surgery. The chance of having nerve damage is well less than 1 in 1,000. In fact, it's a very rare complication. It's very rare for patients to have permanent nerve injury following spinal surgery. Another complication that can occur during laminectomy is Csf Flick. All of the nerves float in a sac of fluid. This sac can be very stuck to the lamina or the ligament around the nerves. When we're removing this ligament, sometimes it can tear a small hole in that sac and spinal fluid can leak out. Now, we repair it at the time of the surgery. However, it does typically keep patients in hospital for a few extra days as we monitor the healing of the wound. Once the laminectomy is complete, we stitch the muscle back together and the skin back together, and this affords enough protection to the underlying spinal elements. Laminectomy is a safe and effective treatment for spinal canal stenosis. For more information, check out my website www.doneurosurgery.com.